Thank you, Mr. Chairman, and certainly thank you to our entire panel here for compelling perspectives and the experience and insights that you bring. This could very well be one of the most important hearings we have for a long time. I was honored to chair the Human Resources Subcommittee that was just mentioned, and we were able to complete the work on the Bipartisan Family First Prevention Services Act of 2018. It's been a while ago already, but even though we did that, I think it's important to note that when it comes to child welfare, we haven't done enough. I would argue we haven't even done anything in many respects since many of the children currently in foster care were even born. So there's much that we need to do. Certainly appreciate the perspective that in pointing out the need to listen to those with lived experience, and very happy to introduce with my colleague, Representative Gwen Moore, the Youth and Family Engagement and Child Welfare Act. Just introduced that this week. This is something that I think is part of the solution moving forward, and certainly appreciate I think a bipartisan approach on that, and bipartisan hearings such as we are having right now. Mrs. Peterson, excuse me, I really appreciate you sharing your perspective and certainly your reflection on your faith-based perspective as it is, and that you can speak from your lived experience. And so, you know, we want to empower more youth to give us their perspective. I think it's important that we at the federal level of government do not become overly prescriptive for state governments that end up tying their hands, rather than having an expectation of states doing positive things and then replicating that perhaps one state to another. But I'm just wondering if you could reflect a little bit on how we have foster care, kids in foster care, adolescents who then age out, and given the fact that I believe our country has more opportunity than any other country in the world, it is inexcusable that we have foster care youth aging out and not linking with that opportunity that we know exists across America, but for some reason we're not linking up here. What do you think we can do to have better results, shall we say?
Yeah, thank you for your work and on this policy. One of the things that I do in my work is that I take former foster youth and youth who have just come from hard places on trips with me. I'm a public speaker, as I mentioned, and I bring them to speaking engagements with me because I believe that they need to see other people who have had backgrounds like them be successful. Foster care is so isolating, so these kids need more opportunities, they need more exposure, they need to see other people who've grown up like them do what they could possibly do. They need to see what's possible beyond their experience and care, and if they could have relationships in the process, form those relationships in the process, that's what's going to change their lives.
Okay, thank you. Mr. Geen, I'm wondering if you could perhaps add some perspective here as well of how, you know, what's most appropriate for the federal level to not go too far, as way too often happens, and yet have the expectation that states produce positive results.
So let me make two comments about the aging out question that you asked. So the first is the majority of young people who age out of care come in as teenagers. We have this feeling that they come in as babies and they spend long periods of time in care, but that's not actually true. And so we have adolescents coming into care, and many of them are not coming in for abuse and neglect. They're coming because of conflicts with parents. They're coming in because parents are desperate to find services and supports to meet that young person's needs. And so the best way to prevent children from ever aging out is to prevent them from ever coming into care. And that is central to what Title IV-B is trying to do. On the opposite end of the spectrum, many states have extended foster care beyond the age of 18 and have that option in federal law. Unfortunately, many states have not taken up that option. And even in states that have, a small percentage of young people decide to stay in care. And that's because foster care doesn't sound all that good. So how do we create a post-18 option for young people that's still in foster care but treats them like adults rather than children?
Just briefly, is there a state that stands out to you as best practices in that state?
I will look at that and get back to you.
Thank you. I yield back.
Thank you.